For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning, everyone. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Thanks for joining us. We're here today to provide some important updates on the Omicron variant here in Santa Clara County, as well as some critical recommendations from our County Health Officer, Dr. Sarah Cody. These are community-wide recommendations. After Dr. Cody speaks to both that critical update and those community-wide recommendations, I'll be with you for a few minutes to talk about the issuance today of a limited health order requiring up-to-date vaccination of personnel in higher risk settings. But first, I'm going to turn it over to our Public Health Officer, Dr. Sarah Cody, for that Omicron update and community-wide recommendations.
Good morning, everyone. I'm Dr. Sarah Cody, Health Officer here in the County of Santa Clara, on this chilly, late December morning to give you an update on Omicron. I want to tell you where we are, tell you about some actions that we're taking, which James will detail, as well as, most importantly, our recommendations for our community in the days and weeks ahead. Since the last time we spoke, which was just less than 2 weeks ago, I warned of a deluge of Omicron, and today, unfortunately, that deluge is here. Our cases here in Santa Clara County are spiking, and the vast majority of them are Omicron. So when I last spoke with you less than 2 weeks ago on December 16th, our case rates were relatively flat. So we look at both how many new cases we have each day as well as rates. And whether you're looking at the number of cases or the rates, they've all almost tripled since the last time that I was here. So for example, we look at how many cases on average per 100,000 people per day. It was around 10 when we last spoke. It's now over 30. On the 16th, when we last spoke, we had some like a little over 250 cases reported that day. On December 23rd, if you look at our dashboard, you can see over 1,000 cases reported on that day. Our test positivity rate is also increasing. So far, our hospitalizations are relatively flat. But we are, of course, concerned about that, and the recommendations that I will share with you today and the order that James will detail for you today are really to protect our healthcare system. So we know that our healthcare system and every healthcare worker in our county and in our region have worked incredibly hard over the last 2 years to care for all of us when we get sick, whether it's COVID or something else. And our healthcare workers are a little tired, but they're still here and they're here for us. What we want to do is ensure that our healthcare workers and our healthcare system can absorb whatever hospital surge may be coming their way. Our recommendations are designed to help ensure that our healthcare system can absorb the deluge that is here now. Each of us, whether we need care for a heart attack, a stroke, a bad accident, or COVID, we need to make sure that hospitals and our healthcare workers are ready to take care of us. So even though we're all a little weary, we are asking everyone to continue to do their part. And we have a few very specific recommendations. The very first and the very most important is that everyone who has not yet gotten vaccinated, please, please, please get a vaccine. If you're 5 years old or more, The vaccines are here for you. Our sites are open and ready to take your appointment. Second, if you're 16 and up and eligible for your booster shot, get your booster shot. What we know is that protection from the initial series of vaccine, it does wane over time. Really important to get boosted and boost your level of protection back to where it needs to be to weather this surge. Second recommendation is to mask. So we're all masked even though we're outdoors because we're a little bit close together. We also recommend that at this point during this Omicron surge, that people not gather indoors unless they're masked. So if you're indoors, whatever the setting is, even if it's in your home, if you've got more than about 10 people from outside your house coming in, we really urge you to keep your masks on. Keep your masks on. Third is ventilation. We talk about these layers of prevention: vaccinate, mask, distance, boost, etc. So ventilate. Whenever possible, move things outdoors just as we're doing now, even if it's a little bit cold. Pop on your jacket, pop on your hat, move things outdoors. And when it's not possible, make sure that you're in a building with good ventilation. And then the next things, we're not mandating, but we're really strongly urging and recommending that businesses and other governmental entities also implement mandatory vaccination requirements for their staff and personnel, and make sure that everyone is up to date on their vaccines, which means primary series plus booster when eligible. For anyone who's not up to date on their vaccine for whatever reason, we recommend regular testing, and of course we recommend testing when anyone has symptoms of COVID. And finally, we recommend that any businesses that serve the public where the business requires patrons to take off their mask, for example, restaurants and bars, we recommend strongly that those businesses require their patrons to be up to date on their vaccinations before entering the business. So I've talked a lot about boosters, and I want to give you a little bit of an update of where we are with boosters, since they're so important in enabling us to weather this next patch. Our county right now, 52% of those eligible to be boosted have been boosted. For those 65 and up, and again, we're quite worried about older adults because of their greater risk of hospitalization, 67% have been boosted. Our booster demand has been steady over the last several weeks, and in our county, we do have the capacity to absorb the demand. I believe that you can get a same day or next day appointment, especially if you're willing to go to a site that may not be right near your home. You can get a booster here in Santa Clara County, and that is what we strongly recommend. So in closing, before I turn things over to James, I just want to say to our community, we are grateful for everything that everyone has done for each other over the last 2 years. I understand that we are all quite tired of this pandemic. However, the deluge is here, and we each need to take some additional steps to get us through to the other side. We've had many challenges over the last 2 years. We've been able to meet them, and I am confident that we will meet this challenge as well. Thank you.
Thank you, Dr. Cody. In addition to the strong community-wide recommendations that Dr. Cody has made, including that all employers mandate up-to-date vaccination, meaning boosters, for all of their employees, today we're issuing a health order that puts in place some limited vaccination mandates and builds on recent actions by the state health officer. So in light of the rapid increase in cases and the expected strain on the healthcare system, on December 22nd, the state health officer updated 3 state health orders that broadly require vaccination by workers in healthcare, correctional healthcare, and adult care settings, so that those orders now also require that by February 1st, workers in those settings be boosted. Today's local health order builds on these state orders by requiring that workers in these and other higher risk settings be vaccinated and boosted, that is up to date by January 24th, and that they be excluded from working in these higher risk settings if they're unvaccinated or unboosted by no later than February 1st. The local order is a limited measure that's intended to focus on protecting vulnerable populations that these workers interact with, to protect the workers themselves and their co-workers, and to ensure continuity of operations in these critical sectors as cases rapidly rise. And it expands on the state requirements in 3 important ways. It applies to a slightly broader set of workers, namely medical first responders such as paramedics and EMTs, those working in shelters, and non-healthcare staff in jails and correctional settings. It moves up the booster date to January 24th, given the importance of acting quickly. And it prohibits unvaccinated workers, including those with approved religious or medical exemptions, from working in higher risk settings altogether, effective February 1st. These workers may still be accommodated in non-higher risk settings by their employer. For the purposes of this limited mandate, the settings that we're talking about, the higher risk settings, are places where there's shared airspace or proximity with patients, clients, or vulnerable populations in skilled nursing facilities, long-term care facilities, adult daycare facilities, and memory care facilities, all healthcare delivery facilities, as well as all medical first responders regardless of where they work, jails and other correctional facilities, and all congregate shelters. Again, as Dr. Cody mentioned, over 52% of those who are eligible in our county are already boosted, but we need to get that rate much higher. Boosters are readily available, but for workers in these higher risk settings, boosters are absolutely critical given what we're facing right now, the need to ensure continuity of operations in those settings and the vulnerability of the populations that they work with. And with that, I think we're happy to answer questions.
This one is for Dr. Coe. Two questions, if I may. So my first is that other counties have required vaccines in places where people congregate to like San Francisco or Contra Costa County. If boosters are so important in this case, why is the county not mandating vaccines in places like restaurants and bars? And then my second question for you would be, you were saying that the hospitalizations right now are relatively flat, but of course you're concerned about that. If they are flat, what are your concerns about where do they lie there, if at the very moment those hospitalizations are flat?
So in answer to your question around hospitalizations, the impact on hospitals tends to lag a bit. So throughout the pandemic, first we see a rise in cases, and a bit later we see a rise in hospitalizations, and a bit after that we see a bump in deaths from COVID. So while we don't yet know exactly how the severity of Omicron compares with the severity to other variants, is that our case rates are going up incredibly fast, and some proportion of people that get sick will require a hospital bed. And so we are anticipating that our cases will exceed what they did last winter. So even a small proportion will have a significant impact on our hospitals. And that's what we are concerned about. And that's why we are trying to do everything that we can to protect the healthcare system so it's there to serve everyone. Regarding your questions around mandating that restaurants or other business settings require vaccination, our rates of vaccination in the county, as you know, are extraordinarily high. I believe we still may be highest rates of vaccination for a large metro area in the entire country. And the complexity now with knowing that you need to be up to date, you need to be boosted. So our feeling is that it's extremely important, but we're not taking that final step of mandating it. Our businesses have been incredibly responsible and responsive and safe with their patrons. What I would say to patrons is, for now, I would recommend patronizing your favorite restaurant by ordering takeout or delivery, by tipping a lot if you're able to support them. But gathering indoors without a mask is not the safest way to be right now with Omicron spiking as it is.
Next question, Spotlight.
Thanks. Why do you think that cases will exceed last winter's numbers, especially as most of the county is vaccinated? And if you anticipate that cases will exceed the number that we saw last winter, can we anticipate any stricter lockdowns or shutdowns like we saw last winter?
Right now, where we are is in a place that's different than we've ever been in the pandemic, and I'll explain how it's different. Number one, we've had now a little bit over a year of vaccines being available. Our population is highly vaccinated. That was not true last winter. However, as we learn about the interplay between the vaccines and the variants, we also know that with Delta and now particularly with Omicron, we see a lot of breakthrough infections. Breakthrough infections with people who are vaccinated but not yet boosted. And that's why boosting is so important. Based on what we've seen about how Omicron behaves in other parts of the world and other parts of the country, it grows with breathtaking speed, a doubling time of around 2 days in many communities. When we look at our epi curve, which you can see on our website, you can see that it is shooting up. So it is likely to shoot up and go higher than it was before. And as I mentioned just a bit ago, even if a smaller proportion of those cases end up requiring a hospital bed, it could still end up being a lot of people just because the absolute number of cases is quite large.
So, sorry, do you anticipate that we'll see mandates the same way we saw last winter then?
As I said, I think we are in a very different place than we were before. We're now 2 years in. Our community and all of us, we are equipped with tools that we did not have 2 years ago. We have plentiful, high-quality masks. Many buildings have been retrofitted and are better ventilated. We have widespread testing, we have vaccination, we have boosters. So I think that what we all need to do is all use those tools, and we will be able to get through this surge.
Hi, Charles Cooper with Concord. Just a question about testing. A lot of people take keep tests at home. If they come back positive, should they report that to the county? Should they get an additional test, or just stay home for a couple of weeks?
If you are ill or exposed, or for any other reason, and then you test positive, you definitely need to stay at home, isolated away from others. At this point in the pandemic, at this moment, I understand that at-home tests are difficult to come by. We have widespread testing, but sometimes it takes a little bit of work to get an appointment. So it is not absolutely critical that you get your home test confirmed with a PCR test. We do not have a way for people to report their home tests. So that brings me to an important point, which is that the cases that we see and report on our dashboard are an undercount of what's actually happening. And we understand that. It gives us a sense for the trajectory, but we know it certainly doesn't capture all the positives. And that's another reason why our focus is going to be on looking at what's happening in our hospitals, because we really need to understand the impact on our hospitals. Thanks.
And Ms. Spotlight? Many dollars from the spotlight. So county data showed a rise on December of residents getting booster shots. Early December, December 1st, the first case was found the Omicron variant in San Francisco, and December 10th in the county. Can you speak about the correlation between the Omicron variant and the rise in booster shots in the county?
We have seen our booster demand stay at fairly steady levels over the last several weeks. I think that the surge in Omicron has inspired many to get boosters and has kept our booster demand stable.
Thank you. The second half is, as of December 27th, it said 52.2% of residents 16 over got booster shots. But the most recent county data, which aired on December 23rd, showed that the rate is trying to decline, also calling them a bell curve. And I wonder if there's your thoughts on this, when the county's going to be
I'm not hearing your question well because there's someone rolling a cart. What's the question?
So it showed that the county data, the last data entered was December 23rd, showed a decline starting, so like a bell curve in the booster shots. So I want to ask you what the county is going to do to try to continue to get people to go forward, since about half of those eligible have received a booster.
I'm not I believe that the demand for boosters has been relatively stable. Sometimes the data that's posted on the dashboard lags a bit before getting in. But looking back, I think the demand has been fairly steady. We're here today to again share with the please get your booster shot if you've not done so already. Our county sites are ready to take your appointment and give you a booster.
Sorry, over here. Nothing.
Dr. Cody, we are already looking at a healthcare shortage of workers. Do you have any concerns that this additional mandate that healthcare workers get the booster will cause that to get even worse?
The reason for our health order is a couple points that I wanted to build on. One, our health order builds on the state's health order, which already offers quite significant protection, and we wanted to build on that further, as James mentioned. We are concerned about staffing at hospitals, long-term care facilities, skilled nursing facilities, which is why it is so very important that staff get a booster to keep them healthy and well and able to serve patients.
All right, any other questions on this side?
Dr. Cody, is it time for people to say their cancel their New Year's celebrations or gatherings?
At this point, with Omicron surging the way that it is, I would not recommend New Year's celebrations unless they are small. Small, intimate gatherings is the way to go this New Year's. It's not the time to go to a large gathering. The only exception would be if you're going to spend the entire gathering outdoors, and if you've got great outside. But it's not it's really, at this point, simply people will be removing their masks.
We have just a couple follow-up before we wrap up.
Yeah.
First news.
Just to clarify with the healthcare workers, are those just the healthcare workers, or is it everyone in the healthcare?
This order applies to all healthcare workers in the county who work in higher risk settings. So that includes acute care hospitals, outpatient settings, skilled nursing facilities, long-term care facilities, and other outpatient settings such as dialysis centers, for example. All workers, correct. All workers, correct.
This is maybe a better question for Sean. So, some a unique aspect of this mandate is that you're going to deny exceptions for those who are religious and medical exemptions. Do you anticipate that there'll be any backlash to that, any legal battles? And then the other question I have is, do you plan on extending this booster mandate to all county employees?
So the first question has to do with the provision in the order that requires the exclusion of unvaccinated and unboosted workers from these higher risk settings. And just to clarify, it does not in any way affect an employer's ability to process and approve a religious or medical exemption, but it affects what is then done in that processing of that exemption. And so just as is true with any number of other medical conditions or other exemptions, if you can't be accommodated in that role, you have to be potentially reassigned to a different role in the organization, or the organization has to take other steps if it can. But this order says those individuals cannot work in these higher risk settings. So that'll be something that employers will have to deal with on a case-by-case basis, just as they do anyway with respect to their employees. But I just want to clarify, it's not itself saying you can't have a religious or medical exemption, but it's saying that those with an exemption can't work in these higher risk settings.
Last question, Kate, go ahead.
Do you think that this county health order will incentivize the San Jose City Council to have similar
So the question was, will this incentivize the city or other employers, including, for example, the county, going back to an earlier question? It is the strong recommendation that all employers in our community have a booster mandate for all of their employees, period, regardless of the higher risk settings. So it's a mandate in higher risk settings, and it's a strong recommendation across the board. We certainly hope that all employers in our community, including governmental entities, will move forward with doing so. And it would be my expectation that the county will follow those recommendations just like it has in the past.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.